Assalamu alaikum and hello. I'm Dr. Iftikhar. So we'll be talking about counseling as in medical practice. And we can easily sort of use the same, another term to use as synonymous of it, that is breaking the bad news. Because the business that we are in, many a times actually the counseling is about doing or telling something to the patient which is not very pleasant. While I'll take you through this all topic, and I have chosen to sort of give you 4 examples on the way. For example, we'll talk about what will happen if I tell somebody that, see, I'm sorry, you have got diabetes, but don't worry about it. We have got good treatment for it, but you need to take treatment for it for the rest of your life. So that's the bad news, that you have to do something about it. But there's a good news, that we can do something about it. It's a treatable disease. Or a lady has malignancy in the breast, so how will counsel her that she has got a problem in her right breast which can be malignant? Or a patient is going to have amputation of, for example, his leg. So how to counsel him, right? And finally, I have chosen another case scenario as well. For example, there's a person who has got carcinoma of pancreas, is very lethal, and unfortunately is in a very advanced stage, stage 4. So let's crack on. Now, there are very many ways to counsel people, right? People do counseling in a very nice way, and people do counseling in a very blunt way. And they give argument, see, I've done everything. I've done everything right. I've given all the right information. I made the patient sit, and the curtains were drawn, and the temperature was right. But that is not enough, right? The counseling actually, to me, is an art. It's an art. It's an art of telling somebody, see, something which is very distressing. So it is giving away, imparting, or breaking distressing information in a way which is organized, that you don't miss things, you do it in an orderly fashion, so that the person who is on the other receiving end, he appreciates that you are a professional in it. You know what you are doing, right? And at the same time, it's effective. It works. It does what you want to do. It imparts whatever information is there and still does not kill that person as well. And you do it in a way which is least traumatic. So to me, the definition of counseling or breaking the bad news is giving distressing news or giving distressing information in a way which at the same time is organized, effective, and least traumatic. Now, there are very many ways to do it. People have worked a lot on it, and they have developed very many protocol or methods or schema about it. Probably one of the best mentioned in the literature that I like as well, and I've sort of developed on it, and that is what we will be talking about, is the spike technique, S-P-I-K-E-S, spike. So if you count, there are 6 alphabets. So there are 6 steps to it, right? Each alphabet sort of denoting a step. So we'll go according to that, that S stands for, first of all, setup and settings, startup and setting. So when you are doing a counseling session, for example, you have to tell a person that he's going to have an amputation, his leg is very bad and we have to do a below-knee amputation. You have to do a certain startup preparations, and there has to be a certain definitive setting about it, right? And then number 2 is that you need to know patient's perception. What patient already knows, thinks about it. That is how you go around that how much more information is required and how to give it. Is patient ready for it? Number 3 is invitation. Invitation from the patient. You need to sort of somehow ask the patient that is he ready to get more information, that you are sort of hoping or wanting to tell him something. Is he ready to absorb that? And then knowledge. Knowledge means, okay, that is the information bit. Do give away the information. So what type of information and how you go around it. So we'll talk about that. And then emotions. So whenever there's a bad or distressing news or information, obviously the people may feel sad, they may break down. So we have to, number one, expect that there will be emotions and be ready to tackle them as well, right? In an empathetic way, So E for emotion and E for empathy. Empathy means that patients or the person who is sitting on the other side of the table need to realize and feel, okay, the doctor is with me, right? He is not sort of distracted or laughing while I'm crying. So he's with me, but he is adequately composed that he can be a shoulder that I can cry on. He is the hand that I can grasp. That's empathy. That you do not need to break down along with the patient, right? So that is the difference between sympathy and empathy. And finally, we have to tell the patient a strategy. Okay, I've told you all that has happened, but we are not without a plan. Despite a very desperate situation, we know how to go around it. So I'll tell you, right? So you give some hope, you tell some future plan, how things are going to be, and how that is going to be organized. And finally, summarize it for the patient. Now, as you see, there are 6 well-defined steps of it. And the first and the last step starts with an S, right? The letter S. And as you know, for example, what does letter S do standardly to a word if you add a letter? For example, I write cat, means cat. But if I write S to it, it becomes cats, which means more than one cat. It's a plural. It makes plural. So same is here. All the 6 stages or the 6 components of it are singular, but the 2 stages, the first and the last, are plural. So there are subcomponents of those stages. So please remember that these are my small tips that I'm giving you to make things easy, right? That in spikes, there are 6 stages, there are 6 steps. And out of those first and last step being an S, so please put it in your mind and sort of tag it that wherever there's an S, it makes the things plural. So there are more than one things. So the first and last component has subcomponents. So we'll talk about them. So right up to now, we have discussed that counseling or breaking bad news is actually an art of imparting distressing information in a way that it is organized, effective, and in a least traumatic way. And I've told you that. The best protocol, one of the best, is spikes, and that is what we are going to follow. And spike has got 6 components, and the first and last, because it starts with S, it's easy to remember that they would be plurals, because S added to any word actually makes it plural. So the more than one comma. So we start with the first step, and that is a startup and setting. So whenever you are going to counsel a person, for example, the amputation person or the lady with the suspected CA breast, right? So these are the things that you do. First of all, you prepare. You don't go unprepared. For example, you are going to talk to the lady, right? And you do not know that you are careless and you don't even have a good idea whether it was the right breast or the left breast. The moment you say, okay, maybe you are going to need operation on your right breast, and she suddenly sort of bounces back, doctor, but I've got my lesion in the left breast. It takes away all the confidence. The patient and doctor rapport just is torn apart. So you need to be ready. You need to be ready with the information, who the patient is, has there been a counseling session already, sort of what sort of diagnosis is there, is the report definitive or are still waiting for some additional reports, are there any other tests, what are the scans saying, what the consult with the, say, oncology was, what the oncologist is suggesting, what is the tentative plan. So you need to be good at that. You need to know about that because the patient may ask questions. So please be prepared, right? And if you want to take the patient's notes, fine, but otherwise make a good summary of it in your mind or on a paper and only then approach the patient. So make a preparation, please, right? Don't go unprepared. It's very embarrassing sometimes. And it certainly will not do any good to your relation with your patient. The second thing is language. Please make sure that you are using a language in a way that the patient understands, right? In our set of circumstances, we may get a patient who is not understanding Urdu at all, and certainly no English, certainly, right? Maybe speaking Saraiki or Punjabi or Sindhi or whatever. Make sure that you understand that language and the patient understands your language. And don't use jargons. Don't use big terms. Well, you have got an adenocarcinoma of the pancreas and the patient is doing, oh, okay, what's that? Maybe it's a nice thing, right? You need to use a term. See, we think that we have got a tumor and the biopsy shows that it's not good. Maybe it has a capability of spreading. Maybe it's something like a cancer or something. So slowly progress on to the point. But don't use scientific terms. And at the same time, sometimes this happens that you are working in a place, for example, you are working in Multan, and the language that you know is Urdu, Punjabi, and probably Saraiki. But the patient is coming from Afghanistan, because we get patients from Afghanistan, and patient only speaks Pashto or Persian. You need to make arrangement for an interpreter. So this is about language, right? So you go prepared. Make sure then when you are talking there, your language is appropriate. You are not using heavy terms that patient does not understand or feels frightened, right? And if necessary, please arrange an interpreter, right? Third thing is, please ensure that you minimize the interruptions during your sitting. I mean, the patient is going to receive a distressing news. This is what this is all about. This goes down very badly, that patient is worried sick about himself, his life or death, or life of a very dear and loved one, and you are talking about it, and then you are receiving calls from your, say, maybe wife or a friend, and you are chatting about your nice holiday trip, which is going to be in 2 days' time or something. Please don't do that, right? It is important that your phone either is silent or maybe even on aeroplane mode, or leave your phone and beepers if you have got a beeper, which is a pager, with somebody else, and tell somebody that please, you are not going to receive any visitors in next 15 minutes or so, right? It's very nice. It's very considerate. That's how it should be. So minimize the interruptions. Now the participants, you have to decide who is going to be there in that session of counseling, who is going to be there, right? You need to include in journal people who are decision makers. You have to have an idea, okay, the eldest son is actually the decision maker and not the wife. Wife is very elderly and bit dementia as well, so maybe she's not understanding it very well. So our anchor person is the son. If I talk to the son, right, he will convey everything and will sort of talk to the family. Or if sometimes the whole family is not in the right frame of mind, but you have seen a friend of the family, maybe a neighbor who comes often to visit the patient, and the family is attached to him. Every time they talk to him, they think that he's a responsible, he's a gentle, he's a friend of the family, and trust them. So you can gently ask them. But if you are including a person from outside, you need to seek the permission of the family. So it may be nice to ask them, is it all right that if I ask Mr. Aslam to sit with us as well? I mean, he's a great friend, and I've seen you that he is very close to you. He's around many times. So in general, family would usually say yes. So it's very nice to include the family, right? Sometimes it is very nice to include a colleague. That if there's some information, for example, there's an information about the cancer, and you think that I am not well equipped to answer that, maybe an oncologist should be sitting with me. So a person from oncology department. Similarly, if there is a female to whom you are breaking the news, the bad news, and you think that it's so traumatic that she will probably sort of be run over by the emotions and may start crying or may even collapse. It's very nice if it's a female patient to have a female nursing staff with you, to put her arm around the patient once she has heard the bad news and is in a really in a very stressful state emotionally. So you need to really think who is going to be the participant of that meeting, right? It's very nice to think about it. If you think about it, you'll make the right decisions. And finally, the settings. Settings means, well, you really don't need a separate room. Sometimes hospitals have separate rooms for counseling. It's written counseling room. But even doctor's office, any place which is quiet, where there are few interruptions, the participants can be accommodated. At the same time, it's convenient for everybody. It's reasonable. You can find a glass of water if you need that at that time. There are enough chairs for everybody to sit, right? Not everybody is sort of coming in and out of that room all the time. Can be used as a counseling room, right? But what would be very bad is to counsel or to break bad news in inappropriate, in bad settings. For example, you are running the stairs to go to the ward and suddenly you find, oh man, remember we ran that test on you and we sent the biopsy. Well, the result is back. Huh? You have got cancer. So see you around. Well, maybe not. Oh, that is not good. That is absolutely not good. I mean, you cannot break bad news running up and down the stairs, in the elevators, in the corridors. This is a very serious thing. Maybe not for you. For you, it may be routine. It probably is. But then routines need to be good as well. So this is what we need to do. This is a setup and setting that we have to ensure that when you are going to counsel a patient, say you have not yet uttered a word. It's all a start. It's all a preparation and a setup and a startup, right? You need to be prepared yourself. You need to understand that I can communicate with the language. If there are any barriers or issues, please do something about it. There should be no interruption. Make an arrangement for that. You need to decide who should be the participant and how many participants are going to be there and what is the setting. It should be a reasonable, it should be a comfortable and an acceptable setting. So that is first S of the SPI. We go to the P. P means perception. And this is, if you allow me to complete it, this is actually perception of the patient. What does patient know or think about the disease? You'll be surprised that most often patients do know about what is wrong with them, but maybe not accurately, right? Maybe not adequately, or maybe over-adequately. He's not as bad as he thinks, right? Maybe he's a bit better, the reports are more optimistic or whatever. So you need to get out of the patient how much they already know. It's a good starting point. See, it is very difficult actually to tell the patient, and it takes a brunt and a toll on the doctor as well, that see, you have got a cancer, I'm sorry. He's a human being and I am a human being. A human being to a human being, this takes a toll on me as well, right? So it would be a reasonable start that if you sit with the patient, right, maybe a hand on the shoulder and ask, okay, you know that we are here to talk about your disease. So what do you already know about your disease? Do you know what's wrong with you? Do you know what's happening? Do you know why we are running all these tests and reports and etc.? Have your family or your previous doctor told you anything about it? So if you tell me what you know already, then I'll fill in the blanks. Something like that. So that is the perception. So see what patient's perception is and start from there. So you may have to correct some perceptions beforehand, right, if they are wrong perceptions, and then you will get an advantage because if patient tells you that, okay, I know that I've got cancer, then that's a big load off your shoulder because patient already knows it. We take it from there, right? The next thing is invitation. Again, let me complete the thing. It is invitation from the patient. You need to get a permission from the patient that can I proceed and tell you more, right? This is very important. While patient has a right to know what is happening into him, patient also has a right not to know. Patient may choose, doctor, please don't bother me with the details. It makes me worried, sick, right? So every so often when you are proceeding with your counseling session, you have to get invitations from the patient. For example, when you were on the perception stage and you ask the patient, okay, Mr. Aslam, can you tell me what you know about your disease? What your previous doctor has told you, right? What do you think is going wrong with you? And the patient tells you, okay, I think I've got cancer. I know that much. then the next thing to go about would be, it would be a nice thing to say, okay, are you ready if I've got some reports and they tell us more detail about your cancer and how we are going to treat it? Is it okay if I go ahead and tell you about this? Are you ready? Right? So please do ask. Maybe the patient is already very worried. Say, okay, no, doctor, I'm sorry, I'm very worried. I could not sleep all night. Is it okay if you tell me tomorrow? I'll be better prepared and while my wife is here. Right? There are so many things that are happening, and these things are as important as the medical treatment itself. See, human being is part body and part emotions. Or should we say 50% body and 50% emotion? You cannot throw away emotions, right? So get an invitation, and then is the knowledge. Now, once you have made the right startup and preparation, you know what the patient already knows and thinks, and he is ready to get more information. Now give the information. Knowledge is the information that you are going to impart to the patient, right? But again, you have to decide. See, there are a lot of steps. For example, patient, you might have found up till this stage that patient knows he has got some sort of a tumor, but he is not sure whether it's a malignant tumor. He does not know what is the stage of the tumor. He does not know that we do not have a good cure about it, right? So these are many bits of information, so break down them into individual bits. For example, initially you can tell them, okay, now that you know that you have got a tumor in your pancreas, I'm afraid the reports that we have got tell that it's not a good type, right? And see how patient is doing. If the patient completely breaks down after that, there's no point going ahead and telling that, well, I'm sorry, it's in stage 4 as well, you're going to die, right? So thereby, you have to sort of impart knowledge in small bits. And the other thing is, never, 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 ever tell the patient lies. This is a principle we have to follow, that sometime the family says, oh, doctor, please tell the patient that he does not have a cancer, he has got an infection, he will be all right with a course of antibiotic. Please don't do that, right? It is all right not to tell the whole truth. I mean, depending how the patient is feeling, what his emotional state of affair is, you can withhold information to a certain degree, but you cannot ever tell the lies. For example, you have sort of reached a conclusion that the patient knows that he has got something wrong with him, but does not know he has got a cancer or a tumor or whatever. He is still sort of confused whether it's infection or something else, or maybe he's just feeling woozy, right? And he suddenly asks you, right, doctor, have I got cancer? Right? But you think that patient is not ready to receive this report because he will just collapse. The state of the matter is so he's completely flushed and he's hyperventilating, he's already collapsing. So you don't need to, you can withhold that. You will not say, no, you don't have cancer. Don't worry, man, you are good. No. But what we can do is that we can withhold information. We can say that, okay, we have got some reports already with us, but we are already, no, we are waiting on some other reports. The information that we have got so far does tell us that you have got a tumor, right? But more details about this, they are still awaited, and some of the reports need more comprehension, more work on them. So I'll come back to you on them maybe in a couple of days. So you have planted a small seed that he may have a tumor, but have not told him sort of anything which is not acceptable for him right now. So you can break down the information, always tell the truth. You can withhold the truth sort of to a degree that you think that the patient will take at the time, but don't go over the board. So this is about knowledge. So you have to be very, very careful. And see, you need to understand that the patient is here and you are here, so you can have a second, third, fourth, fifth session. So you can break down the information and decide and make a plan, okay, I'll tell it next time, and especially when he's got his wife around, because he is not up to the right mental state to take the whole information right now. So, but you can't tell the truth. You cannot tell lies. That is the point I'm trying to make. Now, next thing is emotion. As I told you, once you tell patient things that are distressing, emotions are going to be there. Now, people vary. Sometimes very brave looking people just break down. And sometimes very frail ladies just take it all right. Maybe they're more strong on the inside. But you have to be prepared that there are going to be emotions, there are going to be maybe cries, patient may be sobbing. It's nice to have a glass of water, offer a glass of water. If the patient is, if you are male and patient is male, there is no harm that you go and put your arm around the patient, pat him on the shoulder, right? If it's a female patient, as I told you in the participants, you should have a nurse with you. She can sort of hug the patient, right? Pat her, console her, give a glass of water, maybe ask the daughter to sort of hug the mother, etc., etc. So there are ways and means to handle the emotions. You don't have to kill the emotions, right? Don't have to be harsh. Okay, please be done with your crying, right? Let's get on. That is not the way to go, right? So this is what the emotions are, but at the same time, this should not happen that the patient is crying and you are hugging him and you are crying as well at the same time. That's not how it's going to be, because patient needs a strong, solid rock, right, to land his boat on. He needs a shoulder to cry on. He needs a strong, confident hand to hold on to at this difficult time, and that's you. So you need to show connection with the patient. Patient needs to feel that you too are very sad telling him that. But at the same time, you are doing your best to make this thing easy on him. And not only that, you are working on the other medical front as well to make things better for him. Okay? So these are the emotional bit. So we have done 5 stages. And the 6th stage, which is the last stage, is the strategy and the summary. Now see, you have imported the news. Most of the time it's going to be a bad news. So what is the strategy? How we are going to take it from there? So don't just leave the room now. Don't leave the patient in thin air that, okay, now what's going to happen to me? Right? What's going to happen to me? What's going to happen to my family, my future, my career, my plans? Are they all gone? Right? Please, thereby, first thing is, as I told you, you don't need to divulge the whole truth in one sitting. So you can break it down into multiple sessions, right? Talking to the patient and the family, make a judgment how much information they can absorb now, and sort of make a rough estimate. Okay, I'm going to break it down into 3 sessions. I'll tell about tumor today, and maybe in a day or so, when the wife is around, I'll tell that it's malignant. And then when the family is around and ex-doctor is around, then we'll sit together again and I'll tell them that I'm sorry, it is very advanced, it's in stage 4, so probably we'll not be able to cure it, right? But even then, you have to have a plan next. Give the family a plan. Okay, we are going to do an amputation of your leg because of the reasons that I told you, but we have a plan, right? We have a plan that we will put you through our physiotherapy sessions, which will make your legs stronger, and then we'll have an artificial limb, and you will be up and running in no time. Right? Give them a plan that you have thought about it. Even in a very advanced stage, right, you can tell that there are certain experimental treatments going on. They have shown some promising results in some hospitals. We can enroll you in one of the studies, or whatever. Or we are going to make sure that you do not suffer at all. The patient may say, well, am I going to have a lot of pain? And you can tell, no, we are going to take care of the pain. We have got a hospice arranged for you, etc., etc. Tell a plan. What is going to happen from there onwards? There has to be a plan and a clear-cut plan. It's not the responsibility of the patient at this time to sort everything for himself. That is why we are here, and social services and nursing and everybody's here, right? And don't forget, actually it has to come at the very end, but because of certain reason that I'll mention in the end, I will put it here, that please document in the notes that you have done this counseling session, when it was done, where it was done, who was present. what information has been given and how much information has been withheld, and what is your plan. For example, you say that I have planned to divide this information into 3 bits. I have sort of done the first bit, but the second session I plan to do day after tomorrow. For example, you are off day after tomorrow, then if your colleagues have to do it, then they read your notes and they know where you are, and they can sort of take your strategy and plan from there onward. So please document. It's a legal requirement as well. And next, please don't forget the family may also need support. The patient may be strong. Patient may be ready for the bad news and may absorb it, but the wife may completely break down. So it's not because she is not my registered patient, I'm not going to look after her. No, they too need support and counseling. Maybe wife will need a separate session or more than one session of counseling. So please don't forget the family, right? It's not just the patient. Everybody makes a family, and it's a whole thing that we are sort of rendering our services to. So family may need support. And then summary. When you have done this all, see, it's a lot of information. It's a lot of bad information. It's a lot of distressing information. Please make a summary of salient point, right? Sum them up. Okay, see, so what we have talked up till now is, can I tell you that we have discussed that you do have a tumor, you already knew that, right? And I have told you that now that the reports are back, we know some more things about it, and we know that this tumor is a malignant tumor, it's going to spread. But we yet have to talk to our cancer colleagues, oncology colleagues, and we are still waiting on some other reports to see what we can offer you. So if this is the information you have given, make a summary of it. And I also need to tell you that we do have a plan to go on with your chemotherapy. Hopefully it's going to help, maybe somewhat with your tumor, but certainly with your pain, right? It is going to make it better. And we have arrangement to put you in a hospice, which is very nice, and the setting is very nice. And there are a lot of people and who have a very useful tenure of life there, etc. Right? So give them a summary. And finally, hope. Please never break the hope. No, this is a very fine balance between not telling the truth and keeping the hopes up, right? But it goes sort of in such a way, for example, the patient is amputation patient, and you are telling him that he is going to have his below knee amputation, then the hope may be, as I told you, that you can tell him that, okay, we'll put you through our physiotherapy sessions, and hopefully your leg would be very strong. And nowadays, we have got excellent low leg prosthesis, right? If you are wearing it, nobody will know it, and you can do everything. I know you were a salesman and you used to drive a car. You will be able to drive a car, okay? So this is not end of the life at all. And I know it will not be your own leg, but it would be very close to it. And hopefully, with some practice and with some effort, you will get adjusted to it. So that is hope for him. Now, you may be thinking that, what is the hope for a stage 4 cancer? Well, there's still hope for him, right? Give him hope that I know that patients may be concerned, worried that in the last stages, cancer may be very painful, or it may cause very distressing symptoms. But I can assure you that now the medical science is at a level that we can take care of these things, right? And there are certain chemotherapies and there are certain experimental things as well, which may affect on the tumor as well positively, but I have to check on that. But I can certainly confirm that we can do a lot about pain and distressing symptoms, so I can assure you that you are not going to have pain. No, right? So, and we are going to make sure that your quality of life is good, right? We'll do everything in our power to do that. So that's hope for him. So please keep some hopes up. So this is the counseling session. See, these are the 6 stages I told you, following the spike protocol, starting with setup and settings. Sorry, it is not a setup. May I correct it if you allow me? This is startup. This is start, because how you are going to start it and what are going to be the settings of it, right? This is startup and setting, and then you have to find out what the patient's perception is. Building on that, you have to sort of get invitation from the patient, is he ready to take more information, right? Then you pass on the information, and if there are any motions, you handle them. And then you have to have a strategy that, am I going to impart all that knowledge in one session or multiple sessions? You give the patient a plan of treatment, management, follow-up, whatever, right? You document everything, and if any family member is very distressed, he or she may need also support, and you then give a summary, because this is a lot of information to absorb. So sort of in few sentences, sort of give them a clamshell of, okay, well, this is the nutshell. This is the crux of it, right? 2, 3, 4 sentences, but they have got at least some take-home message. And finally, don't let the hope vanish. So this is a spike protocol. Now, I hope that it is not very difficult, but as I told you, should always be easy and fun. I hope it was easy, and it was fun as well. Well, I'm going to make it easier for you, right? I'm going to write a sentence, and please follow it, right? And the sentence is, prepare, right, in bracket, your lips for my plate of delicious fish. How is that? Okay? So the sentence is, prepare your lips for my plate of delicious fish. Can you say it aloud for me? So I'm going to prepare a plate of fish which is very delicious. It's ready for your lips, right? So prepare your lips for my plate of delicious fish. And as I told you, the first and the last component of spike strategy is starting with S, so there are plurals. So this is the detail of plural. So prepare is prepare, P for P, your is in brackets, so we leave it alone. L for language, I for interruptions, P for participation, and S for setting. So prepare your lip is actually a mnemonic for you to remember easily what are the subcomponents of startup and setting. And my plate for delicious fish, my M for multiple sessions, P for give a plan to the patient, right? D, delicious, never forget to document it. F stands for family may also need help. I is very small, so I'll ignore it, right? And S is a summary, and never let the hope go, right? So my plate of delicious fish, my plate of delicious fish. So when you are doing counseling, you have to remember two mnemonics to remember it all. The first is that it is spike strategy, so S-P-I-K-E-S. So you have to do startup. First component is the startup and setting, then patient's perception, then get an invitation from the patient, then depending on that, impart the knowledge to the patient, and if there are any emotions, handle them, and then you must have some strategy and give them a summary. So that is the whole strategy, but out of that, because these two are plural, so startup and setting has subcomponent of prepare, prepare, right? Language comes in lips, language, interruptions, participation for P, LIP, and S, setting. So prepare your lips tells you all the 5 components of startup and setting. And similarly, my plate of delicious fish tells you about multiple sessions, and P for plans, that is plate, and D for documentation and delicious, F for family member needs support, the F of the fish, and then summary, the S of the fish, and hope, the H of the fish. So while doing counseling, which is an art to impart distressing information in an organized, effective, and least traumatic way, a very good strategy is to follow Spike's protocol, and in Spike's protocol, when you're talking about startup and setting, and finally, strategy and summary, which are the two plurals, please don't forget that I am asking you to prepare your lips for my plate of delicious fish. And thank you very much. Enjoy the fish, as well as an excellent session of learning. I hope you enjoyed it.